This video is going to discuss transitional epithelium. Here we see the tissue of the urinary system on the microscope slide, and we're at the 10x objective. So here is our apical space. Because this is epithelium, we know that we are looking at this layer of tissue right here. All of this is connective tissue. It's beautiful connective tissue, and you'll learn about that in a different video. What we want to do is focus on this apical space. So here we can see that as we move from the basal side to the apical side, the shape of our cells changes. Notice how we have this enormous cell with a very rectangular, flat nucleus. So here we have an enormous cell with a kind of rectangular, flat nucleus. The purpose of this cell is to be able to stretch. So imagine that this tissue is found in your urinary bladder. When your bladder is empty, the tissue can be relaxed. When the bladder is full, the tissue needs to be able to stretch without ripping. So these cells are really squamous in their nucleus characteristic, but the rest of the cell is very large. So what happens when the bladder is full is that the cells are able to stretch left to right as the bladder fills and accommodate that stretch. On the very apical surface, you have beautiful squamous cells. If we look at the histology guide website, again, so we're clicking on the 2111 tissues document. We'll click on that. It'll take us to the histology guide website, and we can see this transitional epithelium. So here's the basal side of the tissue. Here's the apical side. And notice we have these really large bulbous cells right here. And if we kind of toggle back and forth, we can see them kind of beautifully. So these are really, really large cells. In this image, the tissue has more rounded nuclei. And in our cells on our microscope, the nuclei are a bit more umbrella shaped. So this looks a bit more like an umbrella. But this is transitional epithelium.